The Amsterdam University Medical Center presents the Acute Stroke Care Demonstrator of the ASCLEPIOS project. ASCLEPIOS is an EU-funded research and innovation project that develops new technologies for health data security. The project builds a cloud-based e-health framework that facilitates data sharing among acute care teams with security and privacy. A brain stroke can happen out of nowhere. When it happens, fast action should be taken because time is brain. If you suspect someone is having a stroke, call the emergency call center. When the call center professional receives a call, she can use the ASCLEPIOS web application to start an emergency session for that patient. This session enables access to the medical record only by the teams involved in the acute care of the patient. First, she searches for the patient's medical record and starts an emergency session. Then, she adds the address of the patient and requests an ambulance to pick up the patient at the given address. Also, she adds relevant information for the ambulance team. In this case, the patient is located on the 3rd floor and access is possible only through the stairs. The ambulance team receives the request from the call center and starts driving to the patient's location. On their way, the ambulance professionals can read previous medical records and important information about the patient. They can also verify the information added by the call center. When they meet the patient, the ambulance professionals do a triage to determine the next steps. Here, they can request for an appropriate hospital to join the treatment. The patient is placed in the ambulance and transported to the hospital. During the transportation, the ambulance team adds to the medical record measurements and observations about the health conditions of the patient. At the hospital, the acute care team can read all the data available at the patient's medical record, including all the observations and measurements added by the call center and ambulance teams. Upon arrival, the ambulance team delivers the patient to the acute care team of the hospital. Then, the hospital team is well prepared to receive the patient and start the treatment. They add information to the patient's medical record regarding the patient's health conditions. This includes measurements, procedures, and images. After the treatment is performed and the patient is well, the hospital discharges the patient from the emergency care. From this moment, the emergency session is completed.
In the emergency care setting, it's crucial to access data timely and accurately. We need to access this data to set the right diagnosis for the patient and to get the right treatment for the disease. However, it's also important to consider patient data privacy, as we do not want everyone to access these private informations. To do so, we should restrict data to nurses and doctors that are involved in the treatment trajectory and during the treatment trajectory. This is what ASCLEPIOS does very nicely. After the acute emergency care setting, we might, however, also consider access to the data as we want to learn from it or perform research with it or change for administration purposes. This is something that could be added to the current workflow. I really like your project and good luck with future research.
Thank you for watching. For more information, check our social media channels.
Created using Powtoon.